KP's Video News, baby. You know what time it is.
It's time for the news. That's what time it is. All right, folks, here we go. I'm going to jump right into this. And this article that I'm getting ready to read, the topic and the basically just the title of this particular article uh, says the top 11 misconceptions many African Americans have about coronavirus. I'm going to go out on the limb and say that basically these things right here, you know, can apply to any nationality, but this specific article was geared toward, directed toward African Americans because of the misconceptions that a lot of African Americans have about the coronavirus. So don't think it's like one of those racist situations where, you know, I'm just trying to focus on black people and not everybody, because this coronavirus situation affects the whole entire country: black, white, Asian, Hispanic, African, Jamaican, Irish. It don't matter. You know, it affects everybody. So, you know, don't be narrow-minded about this article. I'm just reading it, this article, and this is some information that I ran up on, and I didn't really realize that black people had these misconceptions about the coronavirus, with the exception of I heard people talking about, well, I haven't heard no black people getting coronavirus, and then when the NBA players came out with it, then it was like, oh, I guess we can get it. Okay, here we go. Nationwide, the coronavirus, also known scientifically as COVID-19, has been a global nightmare. One by one, the virus has infiltrated nearly every country, and about 10% of those who have contracted the virus have died. Sadly, there are many African Americans who still don't fully understand what the virus is and how to prevent it. Here are the top 10 most common misconceptions that many in the black community have. Number one is black people can't get it. This is simply not true. To date, at least 3 African American NBA players have contracted the virus. Also, Idris Elba also contracted the disease, and he came out with that information today. Anyway, on with the story. In addition, several African nations, including Rwanda, Nigeria, and Kenya, have all reported individuals who have tested positive for the viral. Therefore, black people are not immune to the virus. Don't let that trick you. Number 2, vodka kills the virus. Most vodka brands are only 40% alcohol, and that's not high enough to effectively kill microbes. The CDC recommends using hand sanitizer that contains at least 60% alcohol. You need health insurance to be tested. Definitely not true. The U.S. government has mandated free testing to all individuals who have symptoms of the coronavirus. All hospitals are required to comply, but not all hospitals may have enough test kits. In addition, there may be a long waiting line to get tested. 3, you should call 911 if you have symptoms. Unless you are suffering from an immediate life-threatening emergency, you should not call 911. You should, however, call your doctor, or visit your local hospital's emergency room if you're not feeling well. And they have a toll-free coronavirus helpline. It's 888-581-5029, and I'm going to make sure that I include that telephone number in my notes at the bottom on the website on this particular thing. That's 888-581-5029. That's the coronavirus helpline. Okay, number 4, the flu is more dangerous. That's also not true. Although it's true that last year more than 60,000 people died from the flu, the coronavirus has been proven to be more contagious, more deadly, and also more misunderstood. Less than 1% of people who typically contract the flu die from it, but so far 3.4% of those who have contracted the coronavirus have died. 6, you must have multiple symptoms. This is also not correct. Many individuals who have tested positive for the coronavirus have only been found to have just one of the major symptoms. Those symptoms are shortness of breath, cough, or fever. 7. Only elderly people die from it. While it is true that people age 60 and over are more likely to contract and die from the virus, younger people must also exercise plenty of caution. The truth is that many patients that are aged 22 to 59 are also being affected. South Korea reported 2,700 cases among patients under the age of 30. Number 8, all Chinese people have the coronavirus. Again, not true. It's true that the virus originated in China, but this does not mean that all Chinese people are affected, nor does it just apply to any type of racial discrimination against people from China or Chinese-owned businesses. Remember that many Chinese Americans have never been to China. 9, there's a cure. Currently, there is no cure or medical treatment available for those who contract the virus. Depending on the location, if a person tests positive for the virus, he or she will be quarantined and will be sent home and encouraged to self-quarantine, drink plenty of water, eating healthy foods with high nutrients, and taking immune-building vitamins are encouraged. And I'm going to add zinc to that list, because zinc is a real good immune-building mineral. 10, you should stock up on water and toilet paper. No government agency has ever made this suggestion. This is a panic reaction from the general population, and the truth is that being inside a grocery store or a big box retailer trying to hoard items like this, you're only increasing your chances of being exposed to someone who could be infected and may not even know it. 11, all travel has been banned. As of March 16, 2020, no type of domestic travel has been restricted. However, the U.S. government has initiated several international travel bans to many countries in Asia and Europe. Most of these travel bans, however, do not affect American citizens, but affect non-U.S. citizens. So, like I said before, if you want to get in contact, you can go to coronavirushelpline.org, and I'll write that on there too, on the page, coronavirushelpline.org, or you can call the coronavirus helpline at 888-581-5029. And that's my coronavirus update for the day. And with the exception of the last story, well, I guess I can do this story now. Since I'm working on a coronavirus situation, I'm going to keep on that. I'm going to stay on that particular topic. Idris Elba is the latest celebrity to test positive for the coronavirus. He made the announcement Monday. This morning I tested positive for COVID-19, he wrote. I feel okay. I have no symptoms so far, but have been isolated since I found out about my possible exposure to the virus. The Golden Globe winning star of BBC's Luther and Marvel's Avengers joins a list of actors who have tested positive for the virus recently, including Tom Hanks, Rita Williams, and the Bond girl, Olga Kurylenko. Elba said he tested last Friday after someone he had been exposed to tested positive. Look, this is serious, the UK actor warned, appearing on a social media video next to his wife Sabrina. Now is the time to really think about social distancing, washing your hands. On Monday, UK theaters closed after government said to avoid public venues. Over 1,500 coronavirus cases have been confirmed in the UK, resulting in 55 deaths. We live in a divided world right now. We can all feel it, Albert added. It's been total BS, but now it's time for solidarity. Now is the time to people to start thinking about each other. And he's exactly right. It's time for us to, get rid of the stupidity and get rid of the stupidity and vote the stupidity out of office here in the United States, because we need to have somebody in charge that's going to be able to take charge and do what they really truly need to do, not just trying to make a profit off of this coronavirus situation, which is what is actually going on in the United States right now. And from what I could see on the press conferences, and then the press conference that they had today, that Trump had today on TV, stating that once again, putting these CEOs out there to speak about what they're going to be doing. Quest Diagnostics and LabCorp, the United States government is taking basically, like you had the CDC. They're the ones that control all this, the diseases in the United States, and he's cut back their budget so tough to now they have to go and use private industry to try to help get more tests created. So they're going to use private industry to create these tests at the advice of the CDC, using the CDC as the people that are showing them how to do it. And this is going to be working to the hands of all those people that have money invested in Quest and money invested in LabCorp. They're going to make a profit off of these tests. So they waited 2 months and a half to get this procedure put into place so they can make money off the coronavirus. And if you think I'm lying, just listen very closely to every word that they're talking about. Every time they have these press conferences on TV, it seems like they discuss more about private industry and the private industry that's involved than they do concerning the government agencies that should be running it. And by the way, in 2018, Trump disbanded the Department of Contagious Diseases. He just outright shut that department down, and then a couple of days ago tried to blame it on Obama. So get the facts, and realize what we have right now. And we have absolutely no leadership. So your best bet is to get all the information you can, double check it, triple check it, stay at home, and avoid if you don't have to go out, don't go out.